today. Well, joining us now is Jeffrey Flaks, President and CEO of Hartford HealthCare. And what a great event you're looking at. This was yesterday, a special surprise by the first season voice winner, Javier Colon, yesterday for the nurses to thank them for all their help. You can see they were social distancing, and it was just a wonderful event there, dancing in their social distance space, some tears, some smiles, just a great event. And tell us how the nurses received the event.
Oh, Lisa, it was so wonderful. The governor, Ned Lamont, came. The Lieutenant Governor, Susan Bicewicz, joined us. We had many people there just expressing gratitude, tremendous appreciation and respect for all of the nurses and truly all people who are working on the front lines of healthcare today throughout all of our facilities. But it was a moment to both celebrate nursing, the profession, the importance of what it means and what it does, and it's never been more clear. And at the same time, to just have people blow off some steam based on the work they're doing within our facilities. It was a really wonderful moment for us.
It was really fun to watch live on Facebook, too. So let's talk about May 20th as we approach it, the target date for the state to reopen. Many are anxious to return to normal, but you say differently. Tell me your thoughts.
Well, when I say not return to normal, I'm talking about health care. So many people keep saying, let's return to normal. I don't want us to return to normal because I want us to be better than normal. And I believe that we've learned a lot through this crisis, and there are things that we can and must do differently as we go forward. Examples to me are around health equity and disparities. And we see that there's opportunities for us to care for and treat with health and wellness programs the people in our communities who are most vulnerable. We must do better. When I see things like telehealth and the way that we've expanded access and our ability to connect patients and people in the community to physicians and caregivers all hours of the day and night, 7 days a week, that's a wonderful thing. We've done it over 60,000 times. And when I see things like personal protective equipment, the fact is there needs to be a national stockpile, there needs to be a state stockpile. And health systems like ours need to increase their inventories as time goes forward. So I'm absolutely encouraged that there's going to be invaluable lessons to come from this, and we'll be better as a result.
Okay. Testing has been critical throughout this pandemic, and I understand that Hartford HealthCare has performed 16,000 tests and even expanded testing throughout the state. Tell us more about that.
It's growing every day, and it was really wonderful to celebrate the 16,000th person who had a test. But when you look at our system today, we have 10 testing centers that are up and operating across Connecticut. It's never been more accessible. For people who call our phone number, 860-972-8100, there's no longer a physician order that's required. We schedule time and appointments for people to go to whatever's geographically best and wherever they can go through most quickly. So I'm really encouraged by how accessible it is and the fact that we have so much testing well distributed throughout Connecticut. It's going to be extremely important as we look to return people to work and bring people back into their communities.
I love it. No doctor involved. Just call and schedule your test. All right. Let's talk about safety. Some have been delaying surgery to avoid going to the hospital. What is your message to people out there who may really need to go to an ER for other reasons other than COVID-19?
Well, first of all, we never shut down. I think it's really important to note, and it's one of the tremendous opportunities to recognize, again, everyone working in healthcare today, for heart attack care, stroke care, emergency surgeries, for trauma care. All of our hospitals have been up and operating and performing surgeries throughout this time period very safely, very carefully. In those areas that are most emergent and urgent, we've never stopped doing. But what is happening now is, in a gradual fashion, other essential surgeries that may have been postponed previously are starting to be stood up. And I think the important point is this is safety first. These are our clinicians, our physician leaders, our nurses making decisions on when and how we can most safely start to bring services back. But I'm really pleased it's starting to happen because there are people in our community who are in pain, who are in some instances suffering, who need care, need treatment, and it can be done safely within our hospitals. And I assure you every precaution is being taken.
Safety first. Always like to hear that. All right, Jeffrey Flaks, President and CEO at Hartford HealthCare. Thank you very much for joining us again today. We appreciate your time.
Thanks so much, Lisa.
Thank you.